My name is Dr. Gene Casagrande, and I'm the Director of Professional Relations with Milestone Scientific. And I'd like to talk to you about the CompuDent, which is a computer-controlled delivery system, and a new product that we have recently been developed to comply with the OSHA regulations concerning accidental needle sticks. This is a disposable, one use per patient, sterile handpiece called the safety wand. And it has three components. The first component is the cartridge holder, which will penetrate through the membrane on the cartridge and then go on the top of the unit. It's attached to a micro tubing, which is now attached to the safety wand. The safety wand will use a lure lock needle, which will be put onto the safety wand as so, and will fit on top of the unit. The safety wand has been developed to comply with OSHA regulations concerning engineered sharps. And when this is in the mouth, the needle can be retracted even before it leaves the mouth. But in dentistry, we use multiple injections. So with one hand, we can project the needle and give another injection. We can protract and retract the needle as often as needed. This complies with all the OSHA regulations in that we can use it in a one-handed manner. Also, this has been FDA approved. It has this 510K designation as a safety device. We have to go through many regulatory testings in order to be able to make the claim that this reduces accidental needle sticks. Basically, the unit works in a way that we use a foot control. What I'm doing now is purging the air out of the system, and this produces two flow rates. The control flow, which is a drop every other second. And at this rate, this needle could be anywhere in the body and the patient would not feel the delivery of the anesthetic. This is below the patient's pain threshold. There's also a rapid flow, which can be used for blocks and infiltrations when the anesthetic can be delivered in a shorter period of time with a larger volume. Because of this technology, we can give injections on the palate that numb multiple teeth without numbing the patient's lip and face. We can give an injection in this area called the AMSA, which will numb 5 teeth, all the related tissue on the palate and the buccal tissue, but not numb the patient's lip and face. And this is a great benefit to both the patient and to the dentist. There's another injection we give in this area, in the nasal palatine area, called the PASA, which will numb 6 anterior teeth and the related gingival and palatal tissue and the labial buccal tissue without, again, numbing the patient's lip and face. This is wonderful for cosmetic dentistry, aesthetic dentistry, where you need to assess the smile line because the patient's lip and face is completely normal. We can also give what's called a periodontal ligament injection using this slow flow technology, which is different from the traditional periodontal ligament injection in that this is not going to deliver a small quantity under tremendous pressure as we do with the syringe or with the ligament jet, but in fact this will deliver the anesthetic at that slow control flow, precise control flow over a period of time. We will be able to use much more of a volume of anesthetic. There's no discomfort on delivery, and there's no post-operative discomfort using this technology. Again, using the safety wand, we can give injections, retract the needle, nobody gets stuck. It basically reduces accidental needle sticks, and in fact, if used properly, can eliminate accidental needle sticks. This is important in a dental office because when a dental assistant or an auxiliary gets stuck with a needle, a series of events occur that are not very pleasant, very disruptive, very traumatic for everybody in the office and for the assistant or auxiliary's family life. They have to make some decisions as to whether they should be getting interferon injections, whether the patient has any infectious disease or not. It's very traumatic. So anything we can do in the workplace to eliminate accidental needle sticks is very important. But more than that, it's the law. Basically, this complies with all OSHA regulations concerning accidental needle sticks, and this, we believe, is very important. It's one of the few items on the market, one of the few dental products on the market that does comply with all the needle stick regulations. As you can see, the lure lock needle is retracted into the cylinder. It's a spring-loaded system. It's very easy to project the needle. As a matter of fact, all that's necessary is for the thumb to lightly push the tab forward until it clicks into place. You can give the injection. After the injection is completed, it's very lightly touch the back tab, the needle retracts into the cylinder.